we want to welcome you to Chat and Chew online, where we chat and chew about more plants on the plate. Today, we're going to be addressing our summer online schedule that'll run into the fall. I'll tell you all about that. And our main focus is going to be Dr. Greger's resources on how to survive a pandemic and how to deal with COVID-19. We're doing things a bit different than the real meeting happened back in July on the 26th. In June. We're riding the bicycle while we're trying to build it. So some things didn't go exactly like we wanted it, although it was a great meeting. And so rather than have all those things together for you, we thought we would just do the presentation so you would have this information for yourself. First, our summer plans. They begin in July the 24th at 12 noon. We'll be Zooming at noon with Brian Hart. He is the executive director of the Esselstyn Family Foundation. And that's a foundation that is all about putting out the word and power of whole food plant-based diet, so that anyone can have that information, even if they don't have resources to pull it in. And they work with nonprofits, and Brian is working to make that happen. His wife, Jane Esselstyn, who is the daughter of Dr. Caldwell Esselstyn, that we know very well in Chat and Chew, who's a real giver to us, the Esselstyn family, she will drop in too, so we'll be able to ask her some questions about how to help people make that change. And that's the topic of the meeting. You know, you may have loved ones like your sister, your mom, your children, who you're concerned about, that you wish that they could put more plants on their plate. Or maybe it's your husband, who sometimes men have the worst time with, crowding out some of the meat off their plate. So join us and we'll work together in a collaborative conversation to find out how we can do a better job. After that, in August, we'll be having a really international Chat and Chew, as we will be reaching out to a guide from Okinawa who takes people to see the centenarians in this very special island that's a blue zone. That'll be on the 27th, and because of the time zone, we have to start our meeting kind of late, 8 o'clock at night, but that makes it work out great for our special person, our guide from Okinawa. So join us for that with your questions and a special surprise at the end. In September, we're going to do the meeting that we had to cancel earlier because of COVID-19. That's Dining with Dr. Guthrie with a cook-along. We won't be able to meet in person like we had planned, but we're going to meet online, and we'll still be able to ask Dr. Guthrie questions. And before the meeting starts, we're going to gather up some materials from our kitchen, some ingredients, and Debbie Zimmerman, our Food for Life instructor, she is going to help us assemble those things into a lovely lunch, and we'll just sit and enjoy our lunch and talk with Dr. Guthrie and ask him questions. He's the immediate past president of the American College of Lifestyle Medicine. He has a great podcast, and he's just written a book. So I think you're going to really be pleased when you have this opportunity. Then in October, we're going to do a Zoom with Dr. Dean and Aisha Sherzai, and I know you know about them from the Alzheimer's Solution book. It's a very powerful book, and they'll address brain health and Alzheimer's. That's October the 23rd, on Friday at 11:30 a.m. We planned this to go to host it at the library, but if that's not going to be possible, we'll be able to do it online as well. We're going to be international again in November. We're going to Zoom with Dr. Pekka Puska. Who is he? Well, besides having a very special name, he is the man who made a real difference in Finland. You see, back in the 70s, there was an area in Finland called North Karela where they had the highest heart disease rate in the world. And at one point, the lives the women who had lost husbands, who had sick husbands from heart disease, they went to the Finnish government and they said, you have to help us. And so Dr. Puska was assigned to that area. He instituted a community-based program, and it made a real difference. Very short time, they lowered that heart disease rate by 85%. Well, back in the 80s, Dr. Deal read the research about his program, and we know Dr. Deal from last year in October when he came to the Ritz Theater and spoke to us in Chat and Chew. He said that he read that research about this community-based program and decided that's the way to go. So he developed the CHIP program, which is one of the best programs in place to help communities of people to come together and change their lifestyle and their eating habits to build health. Dan Buettner, the National Geographic explorer, also read the research and went to see Dr. Puska and came back, and that's what he's doing now to build blue zones here in the United States. He's using the same ideas that he got from that community-based program. So join us for that in November. After that, in December, we'll be going to Bach Tower with our fingers crossed that it really works, because we want to also go into the outdoor kitchen. We'll study long-lived populations, and Debbie Zimmerman will be working with some recipes for us for our lunch from the Blue Zones Kitchen Cookbook. There's more planned in January through April, but we'll catch you up on that as the time gets closer. Today, we want to focus on the work of Dr. Michael Greger in the pandemic and the COVID-19 situation we're in right now. In order to get ready to really listen well, it's fun sometimes to take a little pre-test. So if you have a piece of paper, write down 1, 2, 3, and then just write true or false after each one of these statements I'll give you. First of all, true or false? Dr. Greger just published his 3rd book. True or false? Dr. Greger says that the way we farm animals has changed, but this is not the reason we see a rise in the number of viruses today. Number 3, Dr. Greger says that our lives depend on eating fruits and vegetables. Now listen up and let's see if you got your answers correctly. First of all, let's find out about something about Dr. Greger. Did you know he had a background in infectious diseases? Well, I sure didn't, not until I started studying the material on COVID-19. You see, when he graduated from med school, he went into a hospital in New York where he dealt with a lot of infectious diseases, and HIV was one of the main ones. And it sparked an interest in him, and so he began to study it and learn all he could about these diseases, where they were coming from, and what kinds of consequences they had to humans. And he got so interested, he made it his goal to learn everything he could. He put it together in a presentation, and he began giving this presentation, like on ground rounds to med students. He did those kinds of things. But guess what? Nobody listened. They just weren't interested in pandemics and infectious diseases to a great degree. So he decided, okay, I'm going to put this aside for now because I bet you I'll use this again in the future. And I'm going to look at some of the diseases that are prominent right now, which are chronic diseases like heart disease, diabetes, high blood pressure, obesity. And he did. And that's how nutritionfacts.org was born. And we've all enjoyed those as well. He even wrote a book, though, back when he was really into infectious diseases, and it was called A Bird Flu, a Virus of Our Own Making. It was a powerful book. And it was the first of 4 books. He's written that one, plus he wrote How Not to Die, How Not to Diet, and now he's got a new one on COVID-19 and pandemics in general. What I want to share with you today is one of the important pages on his nutritionfacts.org webpage. This one is called COVID-19 Resources, and it'll be listed in the Show More section below the video screen. So you can just link right to it and take a look at some of the items I'm going to go over. First of all, he wanted us to know a little bit about COVID-19. He wanted us to know that it is a coronavirus, and I'm sure you've heard that word said a lot, and you probably paid close attention and realized that we have had some coronaviruses in the past. In fact, one of our most contagious diseases, colds, that's a coronavirus. We also had some really scary ones. One came in 2002 in China, and it killed 1 in 10 people. It was called SARS. Another one sprung up in the Middle East area of the world, and it was called MERS. And this one killed 1 in 3 people. Now we have coronavirus. Luckily, it's not as bad as it was as those other coronaviruses were, the last 2. Now, if you want to find out more about all of the subjects, Dr. Greger made it easy. He made a 17-part series of videos that dealt with first the pandemics, and then he went to coronavirus and what you can do to take care of yourself. If you click on the word here, that'll take you to those 17 videos. I highly recommend them. And then there's a blue aqua box that also will lead you to notes from a webinar he's done. Now that was a very long webinar, but the notes are very concise if you want to take a look at those too. Where did all these viruses come from? We've been talking about coronavirus, but there were other viruses before them that caused some really serious diseases for humans on this world, in this earth. One of them was smallpox. Do you know where that one came from? Smallpox came from camels. And it was, it was wonderful when they developed the vaccine and it actually went away. It was such a horrible disease. What about whooping cough? Have you any idea where that one came from? It came from pigs, another animal. And what about influenza? It came from farm-raised ducks. Now, let's look at the coronaviruses specifically. We've got, as I said, some coronaviruses that cause colds, and then we've got SARS and MERS. Now you can see most of those came from bats. Now what is it about bats that is sending us some diseases, like the coronavirus? Well, it's because bats live in very tight quarters. There's lots of them, like a bat cave with lots of bats in there. And the viruses have lots of hosts, so they can go from this bat to that bat and back and forth. And then when the bats go out, they use the echolocating system and they spray the virus that has infected them out. So it's able to pass even that way. So that's why we have so many of these viruses that are coronaviruses coming from bats. They are good at it. And usually they give it to hosts that are in the middle, they're intermediary hosts. For example, MERS, it came from camels, whereas SARS came from a civet, it's like a cat. Now, MERS is kind of interesting. We know smallpox came from there, but MERS is so much more deadly. And how is it that these camels had this? Well, Dr. Greger tells us that they probably had this virus for centuries, but it got really bad because of the way we're farming. Yes, the way we farm has changed. Camels are no longer let out to graze in pasture land. They're kept in covered buildings, all squinched up tight, because the demand is so high. And so our factory practices of raising animals is a perfect breeding ground for viruses to mutate. And that's what happened with the coronavirus. And they mutated to such a degree they hit the jackpot, and they're very lethal. And usually that happens when the animals are real close together, says Dr. Greger, because it doesn't matter if the virus kills the host when there's another host right there, because there's plenty more hosts to go and infect. and the virus continues to survive. So the tighter the quarters, the more deadly the viruses can be. Whoa. He tells all about the pandemics in this video that's further down the page. In fact, this video was made 10 years ago when he was really focusing on infectious diseases. I think you'll find it extremely interesting. Dr. Greger does look a little bit different. It was 10 years ago. But he does talk about the bird flu. And that's the one that the people in the health field that look at infectious diseases are most worried about. It began, a deadly one began in 2013 in China and revisited again. And the scary part, it does go into the animals, the poultry business, where all the animals are raised. And in 2017, they found it in Tennessee in one of the poultry houses. So it's still here, and it's in that tight quarters continuing to mutate. Dr. Greger wants us to take this quote to heart. Those who do not learn from history are doomed to repeat it. Do we want to repeat what happened in China? What did happen in China? Well, the H7N9 bird flu virus killed 40% of the people it infected. And as I said, it was in 2013 it was first found and has been found in the U.S. animals, not in people. And this brought back the history from the pandemic of 1918. That was the bird flu also. It continues to mutate. It killed 50 million people, but it only infected 2% of them. It only killed 2% of the people who were infected. So that was nothing compared to the 40% of the H7N1. And everybody's worried about that in the health. So what can we do to protect ourselves from more things like coronaviruses, like COVID-19, or some of the more serious ones, or even a bird flu? Dr. Greger says, let's just avoid having a pandemic. Well, that sounds good, but what do we do? Well, this next video that's on that same page of COVID-19 Resources, it's really an excellent video. It's only 25 minutes. The other one was quite much longer. I think it was an hour. It's really worth a listen. He goes into great detail about how we are creating these petri dishes that are just brewing new viruses with those chickens, nose to nose, snout to snout, in unsanitary conditions, and how that's what's causing all these viruses to mutate to such deadly strength. So take a look at that one, and it does have some information on COVID-19 as well. That will help you. As you go down the page, there's some tidbits on here that you might want to take a look at, like ibuprofen. What about that? So I think you'll find it a very worthwhile place to look. But one of the things in that video, the last video that he talked about was, how do we protect ourselves? And first of all, it's best, if the virus can't get to you, then you can't get sick from the virus. So what's the thing that we should do to keep the virus from getting to us? Well, Dr. Greger says that what we want to do is we want to be sure our hands are really, really clean, that 20 to 40 seconds worth of washing. We want to wear masks because that keeps those germs to us, not to anybody else. And then we want to do our social distancing, which is really important, he said. We want to clean surfaces. We want to cover our mouth and nose with cloth if we sneeze or cough. But he says one thing we really need to pay attention to is our diet, because that's so closely related to the comorbidities that are really springing up as things we don't want to have during COVID-19. He recommends also adequate sleep, reducing stress, exercise, no smoking, all those things that we know make a difference. And when he talks about chronic diseases, nobody can talk about it better than Dr. Greger, because he knows them all so well, and he wrote about them and how not to die. he wants us to be aware of what the research is saying about risk if you have one of these diseases for a severe course of COVID-19, or even having to go to ICU, intensive care unit in the hospital. If you have high blood pressure, for example, you're 2 times as likely to have a severe case of COVID-19 and 4 times to end up in ICU. With COPD, like emphysema, you're 6 times as likely to have a severe course and 18 times as likely to end up in ICU. If you're overweight, not even obese, now this one really got my attention. If you have a BMI of 28, what does that mean? Well, if you have a BMI, that's your body mass index, and it's figured by taking your height and your weight and calculating them together until you get a BMI score. And you can do that on the internet. You just go to a calculator and put your height and weight in, and you can see what it is. If it's 25 or below, that's considered okay. That's normal. And that's not overweight. So that's normal weight. And I think it's 18.8 or something like that. You can go that low before you're underweight. If you have a BMI between 26 and 30, you're overweight. And what that looks like is, let's give you an example. If you were 5'6" and you'd weigh out like 175 pounds, your BMI would be 28. Well, if you have a BMI of 28 at any age, you're 6 times as likely to have a severe course of COVID-19 or death. Scary. And that's why a whole food plant-based diet is so important, because it addresses all of those things. One thing that we can't do much about is age, and that is one of the comorbidities for COVID-19. And he wanted to share with us some of the research that's been coming out from this pandemic. And this came from South Korea. He said it was excellent research because they in South Korea tested so many at the beginning. They really got a good picture of who was getting sick, who was getting really sick, and who was dying. What they found was that if you were 30 or 40 years old, in that category, in the 30 to 40-year-olds, and you're healthy, the chance of you dying from this disease is 1 in 1,000. Now that's great odds, but look how it changes as you get older. And we've been told that our immune system changes as we get older. Well, if you're 70 to 79, it's 1 in 14, and 80 and above, 1 in 5. But there's some good news that's just come out. They're doing research on nitric oxide because one of the earlier coronaviruses was killed by nitric oxide. And so they're thinking that that might help us if we ingest foods that will help us raise our nitric oxide level. And those are those beautiful green leafy vegetables, the cruciferous vegetables. And you can find out more about all of this because Dr. Esselstyn explains it in his last interview on Engine 2 podcast with his son Rip. He goes into detail and explains about it. So I'll put the link down there in the show more, so you can go to that and hear it from him exactly what the research is being focused on now. Dr. Greger, is special to us. He's Skyped with us, and this was back in 2018. We gave him a T-shirt because this was an important quote for him, I think, and it's more timely now than ever. You can see we had a good group for him in our library meeting. He said, "We should all be eating fruits and vegetables as if our lives depend on it, because they do, now more than ever." So, how do we do? Do we catch some of the stuff that Dr. Greger wants us to know? Well, first of all, is it true or false? Did he just publish his 3rd book about pandemics, or did he have more books than that? Yes, he had 4 books there. In fact, somebody told me there's really 5, because there's one on carbohydrates and carbophobia. But anyway, it's not his first book. And we're glad that he puts that information out for us. Is this true or false? Dr. Greger says that the way we farm animals has changed, but this is not the reason we see a rise in the number of viruses today. That's false. Yep, because that is what's changing. We've crowded all those animals in, and they're just sharing viruses and sending back mutations millions at a time. So we have a pandemic of our own making, like he said in his first book. Dr. Greger says our lives depend on eating fruits and vegetables. Is that true or false? True, obviously, yeah. Now, in the actual meeting, we finished it up with asking our participants to think about what caught their attention. And I'm curious, what was it in that presentation of materials from Dr. Greger did you find helpful or just made you think and go, whoa, I didn't know that? Was it maybe that animals are the source of so many of our viruses now, whether it's our factory farms or wet markets? They're breeding some really vicious viruses for us. Or maybe you were concerned when you heard the story about the camels and how they're kept so close and tight, just like we do the pigs and the chickens when they're farmed. That's what came out of our meeting. Someone was very concerned about that. Well, whatever caught your attention, we hope that you can use that to make yourself safe and keep well. And we just want you to know that with our Zooms, we do have time where we can actually talk. In fact, we talked after this presentation, and then we talked some more. And we even had one of our members tell us about what it was like when she had coronavirus. So you never know what you can learn when you come to one of these Zooms. And we invite you to join us at our next one. Please do. Thank you for coming to the presentation on our YouTube page.